today is Dr. Cynthia LaBella. She's a professor of pediatrics at Northwestern University Feinberg School of Medicine and the medical director of the Institute for Sports Medicine. Her research efforts focus on identifying risk factors for injury in these sports and investigating strategies for prevention. And her past research has demonstrated that a coach-led neuromuscular warm-up can significantly reduce the injuries in girls soccer and basketball players at Chicago public high schools. And today she will discuss this research that she works on and age-appropriate clinical evaluation tools, treatment strategies, and short and long-term outcomes for sports-related concussions and other injuries. So welcome, Dr. LaBella.
Thank you. So I'm going to focus my talk today on lower limb injury prevention in sports, specifically in high school-aged athletes. And so I'm very happy to be able to present this on behalf of the Osteoarthritis Action Alliance. I've been on their task force and definitely enjoyed working with the group in efforts to communicate the research that's been done in this area and try to get these programs more widespread use. So when we talk about lower limb injury prevention, it really all starts with the ACL. At least that's where the research has initially focused in terms of preventing lower limb injuries. And so ACL stands for anterior cruciate ligament, and the anterior cruciate ligament is one of the primary stabilizers of the knee. And those of us in Boston, Chicago, and New York know all too well what a tear in this ligament can do to not only an athlete's career, but an entire team's season. All these three athletes pictured here, professional athletes, tore their ACL at key times during the season, and their teams did not fare so well after these stars went down with this injury. I call it the celebrity ligament because it frequently makes headlines when a professional athlete tears this ligament. It's one of the few acronyms that we use in medicine that I feel like the lay public knows automatically what it means, especially those who follow sports. But despite the fact that this makes headlines when professional athletes tear their ACL, this is not the population where this injury is the most common. In fact, when we look at who gets these injuries, the people that are most vulnerable are actually adolescent girls. And so you can see from this chart that high school girls between the ages of 15 to 19, that's the group that accounts for the most ACL injuries that we see. So not only are they more likely, 4 to 6 times more likely to injure their ACL than boys in similar sports, but they're also more likely to have surgery for the injury and less likely to return to sports after the injury. And this kind of shows you, this graph shows you the breakdown of injury rates across all high school sports. This data is obtained from the high school Rio data that athletic trainers, a representative sample of athletic trainers at various high schools across the country collect during the course of the year. So you can see the highest sport here is girls soccer, followed by boys football, girls basketball. But when we look at sports that both boys and girls play where the rules are the same, so comparing girls soccer to boys soccer, for instance, the rate for girls soccer, 11.7, is significantly higher than that for boys soccer, 4.7. Looking at basketball, girls basketball, the rate of 11.2, much higher, much higher than for boys basketball, 0.5. So boys do get these injuries, but at a much lower rate than girls. So the impact of an ACL injury, obviously there's the physical ramifications. These injuries frequently require surgery, especially if the patient wants to get back into a high-level or demanding sport such as soccer or basketball, and or many months of rehabilitation. Even after surgery, it can take 6 to 9 months or longer to get back into a appropriate condition to be able to play high-level sports again. As a result of all of this medical care and treatment, especially for school-age kids, high school-age kids, there's social and academic consequences. to this injury. Athletes can miss a whole season of play. They're disconnected from their peer network. It can limit their future sports participation, especially if it happens during a key year, say their junior year when they're being looked at by college recruiters for various sports. But even from the standpoint of being able to stay active and get back to their previous level of fitness after this injury, that can impact it, even if they're not thinking of playing in college or being looked at for a scholarship. It can have negative impact on academic performance. One study actually done in college students showed that the transcripts, they examined transcripts of athletes that had ACL injuries during the semester that they had their injury. Their grades were significantly lower than the other semesters before they were injured. There's financial implications. Treatment costs are high, and this number actually is old. This is probably from 5 or 7 years ago, so I'm sure that the cost of treatment has increased since then. But probably most importantly, and particularly from the standpoint of wanting to prevent these injuries, is the long-term health, the effects on that down the road for these kids that tear their ACL, particularly because despite treatment, so whether or not you have your ACL surgically reconstructed or not, you just having an ACL injury, you are at a tenfold greater risk for early onset of knee osteoarthritis. And we're seeing this early onset of knee osteoarthritis in that injured knee 15 to 20 years post-injury. So if you're a teenager, that age group of females that where this injury is most common between ages of 15 and 19, that means that when you're in your 30s and early 40s is when this arthritis is declaring itself in your knee. So that's pretty young age to be dealing with this disability. So for those reasons, the focus has been on prevention. How can we prevent this injury? Because even if we repair it, this risk is still high for OA. So the first step in trying to determine and design any kind of injury prevention protocol is to understand how these injuries happen. So ACL injury mechanisms, interestingly enough, 70 to 80% of these injuries are classified as non-contact. So despite the fact that there are frequent collisions in sports like soccer and basketball where these rates are pretty high, the majority of these injuries happen when the athlete is not in contact with another player. So landing from a jump, changing direction while running, or decelerating and stopping suddenly. And so the sports for girls where these movements are most common and therefore are the riskiest for ACL injuries are soccer, basketball, and volleyball. And here's a video, hopefully it's playing, of a volleyball player tearing her ACL. And it's kind of subtle, but when you look at her left knee, it caves inward when she lands. She didn't jump extremely high and seems to have come down just in the right way to injure that ACL. So researchers have looked at dozens of these videos to determine what position is the knee in most commonly when that ACL is torn. And what they've determined is it's this position that they've termed dynamic knee valgus. And this is a position where the hip is internally rotated and adducted or adducted toward the center, where the tibia is externally rotated, and where the ankle is everted and pronated. So this picture on the left demonstrates someone running and changing direction with proper position of the knee, and this shows someone turning and changing direction, letting that knee fall into dynamic knee valgus, and this is a risky position for ACL injury. So what is it about females that causes them to find themselves in this risky position of dynamic knee valgus much more commonly than males? Well, researchers have looked at various risk factors intrinsic to males and females, and one obvious place to look was at hormone levels. Obviously, there are big differences between the two genders in that regard. Estrogen does bind to receptors on the ACL and does increase its laxity. So studies have looked at ACL injury rates throughout the course of the menstrual cycle and trying to determine if there are peaks when the estrogen peaks. However, looking at the collection of studies, there's not been any consistent link between hormone levels and injury risk. for females. Researchers have also looked at anatomic differences between males and females. The male pelvis is narrower than the female pelvis, and so this wider female pelvis in the female creates this Q angle or quadriceps angle that's wider. So the pull of the quadriceps on the kneecap is wider and pulls more laterally, and so the thought is that this position may promote dynamic knee valgus. However, no studies have really linked this anatomic, the Q angle anyway, to increased risk of ACL injury. There have been studies looking at the size of the intercondylar notch, which is the center part of the knee where the ACL lives. Males tend to have a wider intercondylar notch than females, and so the thought being that this narrower notch acts somewhat like a guillotine on the ACL, so that if there's any slight twisting motion of the femur on the tibia, there's a mechanism to tear the ACL. However, the data has been inconclusive from these studies as well. In addition to a narrower notch, females also have a slightly smaller ACL than males, so it may be proportional in terms of it fitting in the notch, just so. The one anatomic factor, however, that has been linked consistently with a greater risk for ACL injury is ligamentous laxity at the knee. So those folks who have knee hyperextension are 2 to 3 times more likely to injure their ACL. However, these anatomic factors, it's all well and good to study them. However, in terms of prevention, this is not a great focus because we can't change the way our pelvis is shaped or our notch, and we certainly can't change the laxity, innate laxity in our ligaments like hyperextension. So these factors are just not modifiable. The good news is there has been focus on neuromuscular risk factors, and these are potentially modifiable. So the research that's been done on this, which I'll kind of review next, is that girls actually tend to use their muscles differently than boys during athletic maneuvers. And there's consistent evidence now that shows that this is probably the primary risk factor for these young girls. And fortunately, as I said, these recruitment patterns, or the way you use your muscles, is potentially modifiable. So this next slide shows 2 athletes jumping and landing. They jump off the box behind them and land. And you can see definitely it looks different, the position that they're landing in, but there are 3 to 4 main differences in these 2 pictures. And typically when I'm giving a live talk, I ask the audience to give me some feedback and kind of point out these differences. But since we're online, I'll kind of go through this myself. One of the big differences, you can see that the girl over here is using a lot less, or her hips are in a lot less flexion, right? She's a lot more upright than the male. Her knees are in less flexion and her hips are in less flexion. And so this is what we call quadriceps dominance. She's using her quadriceps a lot more than her hamstrings to be in this position. He has much more hip flexion, much more knee flexion. You need a lot more hamstring strength, and your hamstring needs to be working pretty much equally to your quadriceps to maintain this position. So that's the one difference. The next difference is that her knees seem to be caving inward in that position that we looked at earlier, this dynamic knee valgus position, whereas his knees are much more in line with his ankle and his hip, straight up and down. And so this tendency to fall into dynamic knee valgus is what we call ligament dominance. And this is that girls tend to rely more on their ligaments in their joints to stop their joint motion rather than contracting the muscles around the joint to slow down or stop the joint motion. So they tend to find themselves in this position more commonly. The next difference, if we look a little further down, is the symmetry at the feet. So if you can see, his feet are, it looks like he's evenly distributed his weight between the 2 legs, whereas she's a little uneven here. She's got more of her weight on the right leg than the left leg. And so we call this leg dominance, and this is where females tend to have a stronger leg. They tend to have one leg that's a lot stronger than the other, whereas for males, they tend to be more evenly distributed, their muscle strength from right to left. And so this is thought to put the knee at higher risk for injury. And then the last thing, which is very subtle, his pelvis is very level here, where she's a little bit tipped to the right. So I think if we had a higher up picture, we'd be able to see she's a little more off balance in her core, and so her core is not as strong as his core. And this is also thought to be a neuromuscular risk factor. And as I said, fortunately, all of these things seem to lend themselves to training, and so we'll talk about that soon enough. This next slide kind of shows where we start to see these differences in terms of growth and development. They seem to develop during puberty. So if you look at boys and girls jumping and landing and look at these positions, they're pretty similar before they hit puberty. But once they hit puberty, we start to see that girls landing in this dynamic knee valgus position. And so the theory is, as to why this happens, is that during puberty, the hormone levels change. And this is where hormones are probably indirectly related to these to the higher risk for injury. Boys get a burst of testosterone, which means that they get in this big surge and increase in muscle strength and mass, and that helps with core strength and coordination. Girls do not get that same muscle growth spurt. So boys and girls are both getting taller and putting on weight, but the girls do not get that same growth in muscle spurt to control that new body size. So the first step at looking at whether these patterns can be modified was looking at, this is a study of high school volleyball athletes. They only had about 11 girls, but they put them through 6 weeks of neuromuscular training, and again, I'll go through these exercises towards the end. And what they found is after the 6-week training, the girls demonstrated increased hamstring strength, which is good, and less dynamic knee valgus moments. So the follow-up to this study was to see if these neuromuscular changes translate into lower injury rates on the court or on the field. And so this is a much larger study, about 1,200 athletes, male and female, in high-risk sports for ACL injuries, soccer, basketball, and volleyball. Half of the girls did the preseason neuromuscular training for the same length of time. They did it for 6 weeks, 3 times a week, 60 to 90 minutes a day. The boys didn't do any of the training, and half of the girls didn't do any of the training. They tracked injuries and athletic exposures for all the athletes over the course of a season, and here's what they found. The trained females, the ones that did the training, had injury rates for their ACL almost equal to the untrained males, whereas the untrained females had the highest injury rates. So there was significant difference between these two groups. We did a similar study a few years back, published in 2011. One of the drawbacks to that previous study that I just went over is it wasn't randomized. So we did a cluster randomized controlled trial in Chicago public high schools. We followed girls soccer and basketball players, almost 1,500 athletes. We taught the coaches how to do a neuromuscular warm-up before practices. And so the intervention group, which is half of the teams, did this warm-up. The other half did their usual warm-up. We tracked injuries and exposures for all the athletes, similar to the previous study. But in addition, we collected athlete baseline information so that we could account for or control for factors, confounding factors such as age and history of previous injury. And we found a very similar result where the girls that did the intervention or the neuromuscular training had much lower rates of ACL injury. And this was true even after we did a regression analysis to adjust for the clustering by team and the significant covariates such as the sport they played, their age, and whether they had any previous knee injuries. There have been lots of other studies looking at this in other programs. This meta-analysis pooled the results from 14 controlled trials, 8 of which were randomized, looking at the most, and this is the collection of sports that these studies covered. Some did preseason training programs like the first study I mentioned, some did in-season coach-led warm-ups like ours, and some did both. And what they found was overall, when you cluster the results of all these studies, there was a 72% reduction in ACL injury for adolescent girls. And you can see here the odds ratios definitely all fall, majority of which fall on the positive side of 1. The key components of these successful programs, they looked at that as well, and what they found is that those that did it preseason and in season tended to be more effective, and those that included these 3 types of exercises. So strengthening for the core and lower extremity, balance training, and that relates to core stability as well, plyometrics, which are repetitive jumping exercises to increase power and strength in the lower extremities. And again, I have some videos of this we can look at next. But one key component for all the successful programs was this issue of giving feedback to athletes about proper form. So whether it's a coach or an athletic trainer or somebody supervising them so that they're educated about how that this dynamic knee valgus is not a safe position for their knees and how to use their muscles to avoid that position while they're doing athletic maneuvers. And then when they looked at compliance, they found that the coach-led programs, the compliance was much better than the home programs that the athletes were supposed to do on their own, which is probably no surprise. So I'm going to briefly take you through some of these exercises. Here is a squat, and this is a great exercise for hamstrings and quadriceps, as well as gluteal muscles, and with particular focus on form. This is why we have her on this line, and the instruction that we give to the athletes is, in addition to not letting their knees cave inward, is especially when you look in the sagittal plane here, making sure the knees don't go over the toes. And here's another core strengthening exercise. This is a prone lift, or a Superman, and this engages all of the extensor muscles in the back and the legs. And then here's another lower extremity strengthening exercise for both quads, glutes, and hamstrings. And again, some of the coaching we give the girls and the feedback is, in addition to not letting that knee cave inward, is making sure you're squeezing all those muscles and you're not just using your quad to do this exercise. Here's a quick balance training exercise. This also helps train some strength too, and helps even out some of the side-to-side differences. As we mentioned, girls tend to be stronger in one leg than the other. So we do a lot of single leg work in this program to make sure that we're strengthening both legs individually. And so she does it front to back and side to side, and she makes it look easier than this is. She's doing a pretty good job. And then I'll walk you through some of the plyometrics. This is one of the beginning ones that we do, just jumping back and forth over a line front to back. So she doesn't have to jump that high, and we don't have them do as many as possible or give them a certain number of jumps to do. We say, okay, you're going to do these jumps for 20 seconds. I want to see you do them with as good a form as possible. So we're not concerned about how many you can do. We're concerned about you doing them with good form. So then she did it side to side as well as front to back. And then this challenges the body in rotation, so she has to jump and land while rotating, and we make her go both ways, clockwise and counterclockwise. And again, with the focus being not how many can you do, but doing them with good form. Now we start doing some traveling jumps. This is a broad jump, two-legged jump. And so the instructions that we also give them during plyometrics is make sure we don't hear you land. You want to land softly. And that verbal cue actually works pretty well at having them engage their muscles when they land so that they're not just falling. Because you sound a lot heavier when you land, when you just let yourself fall rather than when you use your muscles to absorb the force of the landing. Now here's one of the harder exercises in the program. This plyometric, we go from double leg to single leg plyometrics. So now she's traveling and she's on one leg. And this video I like because it does show she has a lot harder time doing it on the left, as you can see, compared to the right. This will show it again. She's a lot stronger and doesn't let her knee knee cave in as much on the right compared to the left. You can play it again. Again, this helps even out the strength in both legs, and traveling down the court is much more challenging. So beyond the ACL, these neuromuscular training programs have actually been shown not only to reduce ACL injuries, but also just general lower extremity injuries, acute injuries, as well as other knee ligament sprains, ankle sprains. Our study did show about a 65% reduction in ankle sprains, as well as sports-related knee pain. So these neuromuscular training programs can go definitely further than ACL injury prevention and really overall lower limb injury prevention. Here are some resources that the evidence-based neuromuscular training programs can be accessed through these websites. There are probably a few more than these now out there, but these are definitely three that have a research base to them and shown some statistical significance in terms of using these programs. So the knee injury prevention program is our program. You can log on to this website. The training is free. It takes about 20 or 30 minutes to go through, and the videos you saw are just a portion of it. There's an extensive video library, and they're narrated, the videos are, so that coaches can learn not only how to instruct athletes how to do the exercises, but the feedback they need to give them in terms of their form. So here's a little more information about that training. And I think that we're just about ready to wrap up, and I'm definitely happy to take some questions if anybody has any.
Great. Thank you, Dr. LaBella. Great presentation, and I think we already have some questions in the chat box, so I'll go ahead and get started if that works with you.
Yep.
Good. Okay. So first question would be if you have any information on carryover to the next season after training with the neuromuscular program, and also do you have suggestions for biomechanical variables that can predict an increased ACL injury risk in a female athlete during cutting/landing? Yes.
Okay, so the first question is a great one. There really haven't been any research studies that follow these athletes over the course of more than one season. Most of them follow over just one season, or if they followed over 2 seasons, they did the training program again as a preseason training or in season for that second season. So the theory is, while we don't have research to back this, is that like any other strengthening program, after about 3 months of not doing it, your strength gradually wanes and the training does wane, so that it's encouraged that the girls do these exercises during each season of play. The next question was the biomechanical risk factors, I believe. So there are some folks that are looking at things like doing screenings to determine who would benefit most from these types of programs. And so there's kind of a pro-con on that. They're not some of these risk factors that you might pick up on a screening. So, for instance, jumping off that box, those 2 pictures I showed earlier in that slide, and noting the position of the knees and how flexed their hips or knees are and how evenly distributed their weight is. There's something called the LESS, which is the landing error scoring system that can be used to identify these biomechanical risk factors. But unfortunately, it's not 100% sensitive or specific in terms of predicting ACL or lower limb injuries. And so the thought being that it seems to make a little bit more sense, rather than trying to screen people and target just those folks to be the ones to train with neuromuscular training, that it makes more sense to train the whole team or train everybody, because there are benefits to these exercises that would go beyond even injury prevention. You can see from the plyometrics and the strengthening, there's definitely potential for just improving fitness and athletic performance that everyone can benefit from, even those that don't have these risk factors. So hopefully that answers your question. And despite the fact that this entire presentation was kind of focused on girls, That's really just how these programs were born, was looking at why is there such a discrepancy in the ACL injury rates. But for sure there are males that can benefit from these programs too, and these exercises. So by no means are these programs, should they be just targeted at females. There are lots of coaches that take our program that coach males as well, and found them to be pretty useful.
I think it's very interesting seeing that there's such a difference between females and males, like you said before. Very, yeah. We definitely didn't do this as much as I probably should have back in the day. But that's why coaching is so important. Another question, do you have any strategies for helping coaches to incorporate neuromuscular training exercises into daily practices?
Oh, yeah, that's a great question. I think that a lot of coaches are really, especially those that have been doing it for a long time, have their own system and they're kind of set with their warm-up already, or they don't have the time to really focus on learning this. I think a couple of ways that we couch this with coaches is we try to emphasize not only the injury prevention aspect of this, but the performance enhancement aspects, so that generally their focus is on on winning and developing skills and developing athletes. Naturally they want to reduce injuries, but that tends to take a back seat. So if we play up the performance benefits of these training programs, that helps. I think keeping it as short and simple as possible. What we learned when we first did our research and we were piloting it, the program, is the warm-up was about 20 to 25 minutes, and we found that coaches just really were unwilling to take that amount of time out of their practice to do this warm-up. So we shortened it to take between 10 and 15 minutes, and that really, really helps. So we try to emphasize, look, this doesn't take a lot of time. Your team is going to be warmed up effectively. You can do this in place of your warm-up, so it shouldn't take time away from working on skills. And so the training, too, is free, and they can do it online at their convenience. You don't have to do the course all at once. You can take it in pieces and then resume it and go back and look at the exercise videos as well. Another thing that really helped was if they came to a live training session, the coaches, we encouraged them to bring a team captain or one of their athletes so that the athlete could learn directly from us the exercises and how to do them and how to lead them. So then the coach wasn't in a position to have to demonstrate all these. That he or she could use one of the athletes to be kind of the demonstrator and lead the rest of the group through the exercises. And we found that the compliance was much higher when the coaches had an athlete take the lead and do the program. So, we try to communicate also through athletes and parents. I think that sometimes if you get a group of very vocal parents and athletes that talk to the coach about, look, we really want to start doing this as part of our practices, sometimes that goes a lot further than those of us in the medical profession, trying to convince coaches to uptake these training exercises.
Great, that's great information. It's a good question. And we'll give just another minute just for questions. I just wanted to kind of also plug the Alliance's Lower Limb Injury Prevention Task Group has released an infographic recently that kind of information from this presentation and a consensus opinion on the best practice features of lower limb injury prevention programs. So for those of you who want to have a shareable maybe from this presentation, I definitely recommend that. It's on our website and it's all over our social media. A big part of getting that together. So just wanted to thank you for that as well, and thank you for presenting today on our Lunch and Learn. This is great information.
Sure.
Sure.
Great. And I think that hopefully everyone has my email address. If people have other questions or comments, I welcome any email.
Okay. And just a brief announcement for our next webinar, which will be July 19th. It'll be with our Alliance's own Dr. Mary Altpeter and Serena Wiesner, who will be giving an overview of our funding opportunity opening next month about expanding the dissemination and delivery of Walk with Ease. So please register for that one as well. And thank you again, Dr. LaBella, for presenting today, and we hope to see you all next